for months to come. Which means that there are a lot of asymptomatic people who are going to be around and our risk is going to be high.
Yeah.
So this is causing a lot of stress because it's easy to lock down if you know when it's going to end. But when you don't know how it's going to end, you have to come to terms with that and make peace with that. And that is the first tip. The
Yeah.
anxiety, the fear, the boredom are going to be around for a while and we need to manage them. They're normal. You must feel anxious. You must be afraid that you might have risk or people you care about could be at risk. So you need to manage that anxiety. The boredom needs to be managed, of course, because we've lost our routines. We've
Mm-hmm.
lost our outlets, the football, the liming, the
Mm-hmm.
eating out are not available anymore. So we're going to have to substitute those. So there's a lot of normal stuff. And I think people shouldn't feel too upset when they're feeling stressed out and nervous because you should. This is a pandemic and there's risk, but
Mm-hmm.
there are things you can do.
Yeah, but what are some of the unique needs? Because is it necessarily all negative? Some people might be actually enjoying this new normal.
Yeah, well, of course. And that's one of the reasons why I said that we're all different. Our
Yeah.
pre existing conditions will vary. Those people who like to be alone at home, who have company, who like being with their family, they're not going to have a problem with that, at least initially.
Yeah.
Others who are accustomed to socializing, who don't like being alone, will find it more stressful. And of course,
Mm-hmm.
the relationships in the household will make a difference too.
Mm-hmm.
If there's conflict and stress in the relationship that pre-exists, then that might be exacerbated by what is going on.
Mm-hmm.
Um, if you are confined in a small space, you have fewer options to even move around, etc. So
Mm-hmm.
that again is going to make a difference. So there can be some positive outcomes, but for many people, there's going to be various levels of stress. And
Yeah.
that can be anywhere from a normal to a more pathological and dysfunctional
Yeah.
effect.
You know, the crew was giving me a little bit of jokes the other day when I said I haven't had a hug in about a month's time, you know. And what are some of the coping tips? Because the lack of physical contact can actually impact your mental well-being, couldn't it?
Of course, we all like, well, I shouldn't say we all, many of us like that physical contact. And for those of us who do it, we become far more aware of it now when we don't have it. And we, as
Mm-hmm.
you say, can look back to when last we had a hug.
Mm-hmm.
Now, if you're at home with others who are at similar risk, then that is not as difficult. But if you're alone, that is a significant problem. But let's
Mm-hmm.
keep in mind that if you break down the hug, there's the emotional component and then there's a physical component. And part of what people are having to learn to do is to get those emotional needs met using, the media and the social media. It's not the same, but you have to ramp up your efforts and express yourself more and expose those feelings and share those feelings if you're going to try to mitigate for the effect of not having the physical contact. The other element of the physical contact is this: it is physical. So anything you can do to make your body feel good, to calm yourself, to ground yourself. And exercise helps for some people with that. Giving yourself a massage. It's interesting. Some people are using a tennis ball behind their back and rolling it against the wall. That gives you a certain amount of physical release. It's never the same as that intimate hug, but there are ways in which we can understand what we need and
Mm-hmm.
then choose alternate strategies to try
Yeah.
to begin to at least meet part of that need.
So we're seeing a number of people, you know, venturing outside, not necessarily essential workers. What gets in the way of us doing what we need to do?
Well, the way you phrase the question is part of the answer. It depends on what we feel we need to do.
Mm-hmm.
People already have habits of living, those pre-existing patterns of behavior that are not always easy to change. There are people who have to be out because that's how they're going to earn some money. That's how they have to go visit their elderly relatives. There are very positive reasons why people may not be staying in. And then there are the more unhealthy reasons where, the reasons that have other motivations.
Mm-hmm.
We learned from HIV that when you're trying to get people to change behavior, and in that context, it was sexual behavior, you had to give them the information. They had to have the facts, and they had to feel at risk. And
Mm-hmm.
unfortunately, in Trinidad, we've been blessed with a relatively low incidence and prevalence of the COVID-19. But
Yes.
the negative side of that is that people don't feel at risk. They're watching it on TV, but so many of us see TV and social media as a kind of reality show. We don't take it personally.
Yeah.
So a lot of people are venturing out without fully understanding the facts of transmission and without personalizing it and realizing that being in spaces where you're in contact with surfaces, not just people, puts you at risk.
Yeah.
Of course, younger people who don't feel that anything is ever going to happen to them have a whole different mindset and need a whole different set of interventions. But we're doing a good job. A lot of the media messages are promoting, and the other important intervention, of course, is positive peer pressure. We need to talk to each other about this. You know, when you see people you know and care about venturing out,
Yeah.
you know, supportively challenge them. I don't mean get into quarrels and fights, but, you know, help them to assess, is this really worthwhile? Show them that you care by showing them that you can support them staying in.
Yeah. You know, I'm happy that you're speaking about some of the reasons that people are not complying with staying at home because, you know, we've been hearing that social distancing is perhaps the most significant way that we can fight this entire situation with COVID-19.
Of course it is, and it's physical distancing. Let us try to reframe it. It's in the social context, but it's the physical distancing, and therefore we have to kind of ramp up how we get our social contact using the media, etc.
Yeah.
And that is again why folks need to stay home. But when they feel pressure to go out, that is where the risk increases. You know, a lot of us don't understand what's going on in our mind. We haven't really. You know, there's a phrase we use, name it to tame it.
Okay.
Many of us live in denial and avoidance of what is going on with COVID because we just don't want to deal with the fear and anxiety. But the truth is, each of us has to look inward and understand what it is that we're afraid of. What are we afraid of losing? What have we lost because of all of these boundaries that are being set on us? How is it affecting us? And then when you know it and you name it, then you can begin to intervene. You can talk yourself out of it. You can meditate. You can pray with a more focus on what you want to change. But first you have to be aware. You have to be aware how it's affecting your body, your mind, your relationships. And then you do something about it. We're having a significant increase in domestic violence. And unfortunately, there's likely to be a lot of abuse in relationships, including with children and elders.
Yeah.
So I think it's going to be critical that we, as I said, at the individual level, increase our self-awareness and coping, but at the community and social level, understand these dynamics and help support each other to make the changes. We're all in this thing together. There are no bystanders when it comes to COVID.
Yeah.
And unfortunately, we have weeks to go before we have our peak. We don't know what that peak will be. But the truth is that even after the peak, there will be many people who are walking around without symptoms, who are infected, and are able to infect other people.
So what
we have to come to terms with that reality.
So what lessons can we learn from previous public health experiences then?
Well, as I said, with HIV, for example, we learned that people need information. They need the facts, but they don't need facts that are going to make them afraid and turn off and become paralyzed. They need to have facts that will help them make choices. So we need information. We have to understand what the mindsets are that exist. As I said, whether it's young people, whether it's the elders who don't quite understand, whether it's people who have competing needs and have to reprioritize. So we need to target our messages, and we've been doing some of that here and in the region. And then, of course, there's the unfortunate part of it that some people will not change until they feel a personal sense of risk.
Yeah.
And that is, again, where the media comes in. How we have to find ways to balance this message that we are really all at risk without then turning people off and making them stop paying attention or freaking them out and causing their stress to lead to dysfunctional behavior. So those are some of the lessons. And I think another lesson we learned, of course, is in partnership. These messages have to come from the media, they have to come from the faith-based organizations, they have to come in the existing institutions, and they have to come from each of us in families and communities, etc.
Yeah.
Repeated messaging, contextualizing, personalizing, and then skills building.
On that note, Dr. Weller, we're going to have to leave it there, but thank you so much for joining us this morning. We'll be chatting with you once again, I'm sure. All right, that was Dr. Peter Weller, community clinical psychologist, giving us some useful information there with regard to coping with COVID-19, brought to you by National Gas Company Limited.
Coping with COVID-19, brought to you by NGC, at the forefront of energy.